Good morning, everyone, and thank you for joining. I know folks have come from the New Jersey area and some are coming in from all the way from India. So thank you so much for joining us on this talk. And I'm Dr. Subh Agarwal. I've known Atul for some time now. Uh, and I think most of you know Atul. So I'm a cardiologist and I teach medicine and I practice medicine at the Medical College of Wisconsin. And a little bit about me so that you understand that what is my background and how did the holistic workshop come about and what we have been doing. So, so I went to medical school in India, in Mumbai. And from there on, I came to New York, did my internship at SUNY Brooklyn. I did well in medical school. And then I did my residency in medicine at Pennsylvania. And then I did a emergency medicine training in University of Illinois. I practiced for a few years, but I wanted to learn more, I guess. So I went on to obtain a master's in cardiovascular epidemiology. Then I did a fellowship in cardiology and then got some further training in electrical cardiology at Chicago. And I practiced in my life these various disciplines. So the reason I wanted to put this out there is that sometimes, you go on the web, you get information from folks who may or may not understand the complexities of the disease process. They may not be able to understand the papers out there or understand the epidemiology versus someone who may have the adequate training. So that's what I've been trying to impress here. So without further ado, I just wanted to talk about the coronavirus. But before we get into this coronavirus pandemic, I wanted to tell you a story. That how did we get here? And were we expecting this pandemic? Did we know that this pandemic was in the making? So if you go back many years ago, when we were not even here, there was this war, the First World War from 1914 to 1918. And at the end of the war in 1918, incredible virus appeared. At that time, the population of Earth was 1.8 billion. And this infected 500 million people across the globe. 500 million. And it killed 50 million people in the world. And 675,000 people died in US alone, by the way, from this incredible virus. And it was named the Spanish flu. So the good thing was it lasted for a year, from 1918 to 1919. We did not have technology at that time. We did not have NIH or NIA or CDC. We did not have mechanical ventilation, critical care understanding. No antibiotics were there. The first antibiotic was discovered in 1922 by Dr. Fleming, the penicillin. And we are talking of this virus of 1918. So you can understand from the pandemic that pandemics can kill. But today, luckily, we have vaccines. We have antiviral medications. We have antibacterial to fight secondary bacterial infections. We have trained physicians. We have ICU. We have trained nurses. We have mechanical ventilation. So a lot has changed. But I can tell you that this pandemic didn't start just in 1918. It started somewhere in 1900. And from 1900 to 1915, it started infecting animals and humans. There was antigenic drift. And over time, it became virulent and pathogenic and infected humanity. And the toll was enormous. So I was doing some research on the Spanish flu epidemic. So it reached the far corners of Earth. So if you look at Alaska, no one lives in Alaska. Today in that village, there's a village in Alaska where still 400 people live. In that village, in 1918, 80 people live in that village. Within 5 days, 72 people died in that village from the Spanish flu. It was this deadly. So to overcome the problem, you have to first understand the problem to find the solution. So we did not have any technology to understand this virus. But in 1950s, there was a young microbiologist from the University of Iowa, Dr. Johan Hultin. He went on a mission. He went to Alaska, dug up those graves after permission, and biopsied some tissue from the buried bodies and brought it back to the University of Iowa in the quest to understand the genomic sequence of the virus. Unfortunately, he was not successful. He did not have the technology at that time. Fast forward to 97, at the CDC lab, there were two, microbiologists, and they're still alive, Dr. Taubenberger and Reid, and they were able to sequence this virus with Dr. Hultin, who again made a trip to Alaska and bought again lung tissue. And then so this is reverse genomics. This virus is over, it's gone. And they were able to go back, get this virus, understand the genomic sequence, and then there were other microbiologists involved in Mount Sinai, and they were able to understand this is an RNA virus, how does it replicate, and then in a level 3 security lab in CDC, they were able to make this virus alive in 2005. So in 2005, they brought back the 1918 H1N1 virus back to life. And they found that it was extremely virulent and pathogenic. They infected the mice lung with this virus. And it grew, compared to the seasonal flu, by the way, within days, it replicated and grew 39,000 times faster. So it was this pathogenic. So today, do we have the cure for the H1N1 virus? Let's say the Spanish flu comes back. Do we have a cure? Yes, we do. The drug we take, Tamiflu, oseltamivir, it works against H1N1. The vaccines we have today, they do protect us from H1N1. So if the Spanish flu were to rear its ugly head today, because we have understood the virus, we've sequenced it, we have the wherewithals to fight it. But there's antigenic drift. These viruses replicate. And when they replicate, they make copies, there is change of their genomic structure. That's why it's very difficult to find a stable vaccine. And hence, every year we have to get a flu vaccine. It has become, epidemic. So now you understand the dangers of pandemics. They can happen. Again, this happened in 1957, in 1968, and then in 2003, and the latest was in 2013, the SARS coronavirus 1. So the other thing to understand is that these are zoonotic diseases. They jump species. They came from animals to humans. And they became pathogenic and started spreading within humans. So this H1N1, by the way, came from, it's called an avian flu. It came from birds. That's the theory. We don't know if it came from pigs, but they believe after sequencing the genome that it came from birds. Similarly, the bats have been known to carry influenza A virus. And initially, the CDC thought that it's almost nearly impossible for these bat viruses to transmit to humans because this requires some kind of reassortment. A mammalian host, some animal has to get infected simultaneously with a human influenza virus and a bat influenza virus. And their genes have to meet together and come up with a new strain that will infect the humans. But already we have had MERS and SARS-1, which came from bats. So it has been replicating over these years, slowly marinating. And today we have COVID-19 from the SARS coronavirus 2. So that's where we stand today. Good news is that we have the technology. Immediately we were able to sequence this virus. So this is the cartoon which you see now. It's called corona because of these spikes like protein which comes out. So you can see on the screen these spike-like glycoproteins. That's where it gets its name from. And this is an RNA virus. You can see the RNA virus is inside here. This is the one which gets into our cells and starts replicating. And this is a pathogenic strain. It gets into our cells through a receptor called the ACE2. That's how it comes into our body and starts replicating. The ACE2 receptor is present in our epithelium of the mouth, nose, lung tissue, heart, kidneys. So it's present in a lot of tissue except the brain. So you can see it is not causing any neurological issues, but it is causing heart issues and lung issues primarily. And now yesterday we found out that the kidneys are failing. So folks are going on dialysis. So as you know, heart, lung, and kidney, they have these receptors. So there's misconception and there is a lot of thoughts that how did it come about? And we think that the source, the origin of this virus is from Wuhan, China. And in fact, it's true because the initial viruses, the previous viruses, the MERS and the SARS-CoV-1, coronavirus 1, also came from China. And these are bad viruses. And so it seems like they have been replicating over time. And now it has become pathogenic. 85% of the structure of coronavirus 2 is shared by the coronavirus 1. So there has been antigenic drift over time to the point that it has become that pathogenic. So that's the source, we think. They have a lot of wet markets where they slaughter live animals. So we feel like that could be the source of infection. Now there's all this conspiracy theories going on that could it be coming from the lab and this and that. That's always possible. We will never know these things, even 100 years later. Just like we are experimenting as we did, we brought this virus from Alaska, did reverse genomics, and made it alive in 2005. I'm sure countries across the world, they have labs, they do research. So always it's possible that research can lead to release of virus. But right now we are presuming that there is these wet markets which is causing this. There's some folks waiting to join. So moving on to the next slide. What are the symptoms of coronavirus? How do you know if you have coronavirus, COVID-19? Most of the symptoms are mild. So that's the good news. A lot of folks may not even know they have this condition. They may have a slight fever, they may have a sore throat, dry cough, they may have flu-like symptoms, they may have body aches, and that's about it. And they will recover. But in some patients who may have immune deficiency, their immune systems are not as strong, or they may have other comorbid conditions such as high blood pressure, diabetes, heart disease, kidney disease. They are more susceptible. Those who are older or very young are susceptible. And they can develop something we call acute respiratory distress syndrome, meaning the lungs get filled up with water, there is loss of oxygenation leading to hypoxemia, and kidney failure. All those things can set in. It can infect the heart, can cause myocarditis, and can lead to even death and ventilation. So those are the symptoms we are dealing with. We have a lot of patients in our ICU who are on ventilation, but we are learning as we treat these patients. So we were intubating these patients early in the course of the disease. We found that it was causing more injury to the lungs. So now we are treating them with high flow oxygen. And we are delaying intubation as long as possible. So that's one thing. Second, we are proning them. We are putting these patients on their belly. Even if they're in the hospital, we are telling them, if you have COVID-19, please go on your belly and sleep on your belly, if as long as possible. The longer, the better. We are teaching them some deep breathing exercises. And when they're in the ICU, also it's a hard job for 10 nurses to come and turn the patient because they're intubated, but we are turning these patients so that they can breathe better. The whole idea is to open those areas of the lungs which do not get that much ventilation. So that's the idea behind these things. So what are the treatment options? So the treatment options are, now we do have antibacterial. So if they do get secondary bacterial infection, pneumonia, we can treat them with, third generation cephalosporins. We are giving them doxycycline. There's reports coming from France and China about the use of hydroxychloroquine, so we're using that cautiously. There is some encouraging data regarding antiviral called remdesivir, because this is an RNA virus. So we are trying to use antivirals. So the drugs we have used against HIV have been studied in trials. Some have failed, but it seems like remdesivir may have some success against the virus. We showed that patients did well when they were on this, at least in Chicago. But there are no trials, so we don't have the data. There are some studies coming on hydroxychloroquine and zithromax. And there is a study from China where they had 100 patients, and they did some small pilot studies in France with 36 patients and 80 patients. And the same group now has done 1,000 patient study looking at hydroxychloroquine and antibacterial zithromax. And they show a 96% success rate. So there are some, positive results coming. We are working very hard to find a vaccine because that's what we need against this virus. We have vaccines against the SARS coronavirus 1. SARS stands for severe acute respiratory syndrome. So we do have vaccine for SARS coronavirus 1, but in studies it failed to prevent the replication of this virus and from preventing the infection of the human cells from this virus. So unfortunately, the vaccine we have for 1 did not work for 2. So we need a specific vaccine for this one. So many companies are involved. Your company, J&J, has a lead vaccine as well. And then Moderna, there is a company in Seattle. They're entering phase 2 trials now. They were able to do phase 1 that was successful. Oxford is doing a trial. Australia is doing a trial. So many pharmaceutical companies and governmental agencies are combining together to come up with a vaccine. Unfortunately, we won't get it till the fall because they have to do phase 1 trial, which is a safety, and then efficacy, phase 2, and 3 is the main trial. So we are not expecting a vaccine late in the fall. Hopefully, we'll have a vaccine. That's the hope. In the meantime, we are treating patients with antibiotics, common sense measures. We still have to follow social distancing because if every one of us gets sick at the same time, it will overwhelm the healthcare system. So if 2 fall sick, then we can take better care of them. We can protect our nurses and physicians. So that's the whole idea of this curve. So this is what I wanted to show you, that there are some concerns coming regarding the use of blood pressure medications. So basically, they're saying that if we give them ACE inhibitors or angiotensin receptor blockers like losartan, we can increase the amount of ACE2 into the system. And this virus attaches through ACE2. So that's the concern. But actually, ACE2 is the most beautiful enzyme. It is a counter-regulatory enzyme. It actually prevents the rise of blood pressure. It is anti-inflammatory. It is an antioxidant. So in fact, it is helpful in preventing the severe lung injury and pulmonary hypertension you see because of various other mechanisms. So you don't have to go into the molecular biology. In fact, they did studies where they gave patients recombinant ACE2, and they were able to bind the SARS coronavirus 2 and decrease the amount of SARS coronavirus 2 which is available to attach to the tissues. So I think we have some exciting technologies. We are understanding the disease better. And I think we have medical therapy to some degree, but also we need to continue to follow social distancing, sanitization, deep breathing exercises. We can take vitamin A, C, and D, as well as zinc and magnesium, and work on getting our immunity better and stronger. So I hope that I know it's very short, but that's the whole idea of doing a short visit so we can, clear some misconceptions. So what I'm going to do now is that I'm going to unmute everyone, and
Yep.
we can take questions at this time.
So, Dr. Shubh, I want to ask is, I think you talked about that it attacks our immune systems.
Mm-hmm.
So, and between our conversation, we talked about, how to strengthen our immune system by lemon water and say kali mirch and haldi and all. Can you talk a little bit about that? Because most of us here are from Indian background. Microbial load in India that we all grew up with, like first 15, 20 years of our life, that gives our genes an added advantage against COVID-19. I have been reading about that.
I mean, we are still trying to understand all this, right? So I don't know the full answers, but certainly, so this is how it is working. It is getting into our body. And if you have a weakened immune system, our immune system is mounting a response to this virus. And it becomes over responsive. It causes a hyperimmune response. And that is causing the damage to our cells. So it's almost acting like an autoimmune disorder. It activates our immune system. So if you have a strong immune system to begin with, then I think you can prevent from getting infected. Now, why is it less in India and in Africa? There are some theories out there. It's possible that there are malarial endemic zones, and they use chloroquine in those areas, and that's one. Second, this is a heat-sensitive virus. So if you expose this to heat more than 65 Fahrenheit, it dies. It does not survive outside a host body. Every virus requires a host, tissue. So when it is outside the host body, it will die. I mean, it can survive for a long time on cardboard and plastic and all that, but it will die quickly. And that's the whole idea. That's why we think that because it's a malarial endemic zone, and they have higher use of anti-malarial medications. And second, we believe that because of the heat, these countries are less effective. Now, absolutely, if you use antioxidants and immunomodulators like turmeric and vitamin C from, let's say, amla, which has one of the highest vitamin C and antioxidant in the world, actually. Here in the US, you could eat blueberries. You could do the same thing. You could eat strawberries. You could use elderberries. They do the same job. Raspberry and strawberry, by the way, so there's a recommendation about how much vitamin C you need every day. If you eat 1 cup of strawberry, you get 150% your vitamin C level recommendation. So you're actually getting 50% higher. So you took 1 cup of strawberries, which is 8 pieces, and then also you took 1 cup of raspberries. There you go. Now you got 250% because raspberry 1 cup is 100%. And then on top of that, you had oatmeal in the morning and you added blueberries. So you're getting your, vitamin C. I mean, high amounts of vitamin C. Now in the morning, if you get up and you drink lemon water, each lemon is giving you almost 80% of your recommended daily dose. So imagine if you do these practices every day in your life. you are building up vitamin C. Vitamin C is extremely essential to build up your immunity and for cell repair and cell integrity and all that stuff. You can, if you go on my YouTube channel, you will be able to see some of my videos where I have posted information regarding, antioxidants and whatnot. So does that answer your question?
That does answer my question, but it actually, because today it is COVID, tomorrow it will be something else.
Right.
So, and it is important because I've got opportunity to attend your workshop in Chicago. So, which talks about holistic living. And that's the reason I wanted you to have this workshop, so that you can share how important it is to basically go into that path where you are actually building that immunity by default. It is your second nature, so that whether it is COVID or anything else, you should be able to handle it if that comes, right?
Absolutely. Yeah. So definitely. You have to be prepared for infections and pandemics, which will happen. We are getting flu every year. That's one pandemic, epidemic disease which happens every year, seasonal flu, and we are not. We don't even talk about it. But last year we had 60,000 plus deaths from seasonal flu virus in the U.S. alone. Correct. And 645,000 people died from seasonal flu all over the world. 645,000. That's a lot of people. Yes.
Yeah.
We don't even talk about that. Right now, we are dealing with COVID-19. In the world, we have had, 60,000 deaths so far? 61,000, something like that. It's nowhere even close to the 65,000 deaths we have from seasonal flu each year. It's on a trajectory. It will cause deaths. We know that. But I'm just trying to put it into perspective that we have so many deaths every year from just flu, seasonal flu. And then we have cardiac disease, which is killing people. So I was, in my video, in one of my videos I posted, I talk about that how many people die from heart disease. Do you want to take a guess? 49,000 in the world every day die from heart disease. A death every 2 seconds die from heart disease. From cancer, 27,000 deaths every day. So, we have to do something about it. That's your choice. You could choose today to change your life, or you could choose when you're in the grave. That's a choice everyone has. So, we are dealing with this. We are dealing with COVID-19. We're talking about that. But absolutely, as Atul mentioned, we have to be prepared for more pandemics to come. In fact, the flu, which is coming every year, how you can boost your own immunity. So I think turmeric is your friend, ginger is your friend, garlic is your friend, antioxidants like lemon is your friend. There are so many things out there. So I think, but you have to be healthy. You cannot just eat a lemon and say, okay, I'm going to go to my Pizza Hut and go to McDonald's now because I'm immune. Like Ravan, I have the boon of Brahma and I am not going to die. I'm immortal. So I think you have to make changes in your life besides eating these things. You know what I'm saying? So that's the whole idea, that's why I put my background out there so you understand where I'm coming from. That I've seen these things. I have worked with some of the best minds in the world. And even the best minds sometimes are driven by, financial considerations. I can tell you that if I put a stent, if I do a CAT, I make a lot of money. I should not be even investing my time here. I can tell you that I make $10,000 from one diagnostic heart CAT. One diagnostic heart CAT. The hospital makes it. I don't. But the point is that I still make some money from that. So I could tell everyone, yeah, just get a stress test. Yeah, you have chest pain, get a stress test. And come every year, we'll do a stress test on you. We'll do a CAT on you. That's how medicine has been practiced, by the way, just to be, fair to you all. This is how medicine has been practiced, even by the best minds. When I was in Chicago, they are great hands. They understand the condition. We know ablation doesn't work. atrial fibrillation ablation has never shown to increase survival. Never. It only may take away your symptoms of palpitations. And this is a new condition, by the way. The reimbursement to the hospital is huge. So the hospitals want everyone to get ablated. We make $50,000 on one AFib ablation. So I could easily just do that. I actually did electrophysiology, as I mentioned. So I could just easily do that and be very happy. So, but I came out with this because I feel like, let's be honest. Let's treat everyone like family. And if you do that, I think you will feel happy, you will feel blissful, and you will end up making an impact on the world on a larger scale. That's how a holistic workshop came in. So, we
Yeah,
are helping people lose weight and reverse their disease. So, all those things are there.
yeah. To me, that's Shubh. That is a really great point, because whenever I worked with you, you said it very rightly that if you have if you make money, you're actually cannibalizing your business by hospitals are business, right? You're cannibalizing your
Yes.
business by saying, okay, be proactive, people, so that you're not in that situation that we have to use a respirator or things like that. So that's what this workshop is all about. We didn't get a chance to actually circulate this that much, so
Right.
probably attendance is not that great. But
Right.
please tell people, because I think more sessions like this will going to help in educating how to
Yes.
take a life to in a natural way, in a natural
Absolutely.
direction.
Absolutely. So if anyone is interested, you can go to my YouTube channel. So it's very easy to access. I had a slide. For some reason I cannot. I'm not that tech savvy, as you can tell. But basically, I do have a YouTube channel. It's very simple. Just go on your iPad or any smart device and type YouTube. And on YouTube, type Holistic Workshop, HOLISTIC, Workshop, WORKSHOP. And once you do that, you will, a slew of options open up, but you will choose the lotus symbol. And there's a story behind that too, why we chose the lotus. Lotus is growing in, muck. You throw muck and still out of there's this beautiful flower which comes out. So we are dealing with so much of nonsense in healthcare system. So that's why I chose lotus as the symbol of our, YouTube channel. We have a website, holisticworkshop.org. Please, you can follow us on Facebook as well. So we post some, social media messages, and sometimes we post our videos over there. But all the videos are available for free on our YouTube channel. We post one roughly a month, but now it has been a little bit more active because of the COVID-19. I posted a few more than usual. And you can subscribe to my channel. It's all free. And feel free to share with your friends and family if you find it useful. And in addition to that, we offer a workshop. So we offer a physical platform where you can come to Chicago and do the workshop with me. It's a 5-hour program with some follow-up of 3 months. And also now, because of the COVID-19, we're offering a virtual platform where you can call us, you can call it 773-831-7660. And we can offer you a virtual platform where we can, I can be with you face to face, and we can do a virtual holistic workshop in this current crisis till we meet on a physical plane.
Dr. Shubh, can you hear me?
Yes, absolutely.
Yeah.
Yeah. I'm Shikha. I'm from Delhi. I'm in Delhi. And recently my son's friend was infected with corona, and he was in Bangalore. And he was sharing the whole hospital. They were giving the neem juice and
Okay.
mooli ke patte ka juice. So
Okay.
I just want to ask, like, is it a remedy, or we can take like now also as a
Yeah,
preventive measure?
I think you can. I mean, there's nothing wrong with that, but again, that's the problem. These are unverified scientific things. These are just observations. These are anecdotes, case reports. If you take one case, they got, 80% of them are going to get better. and you have given them something and you feel like, oh, my intervention worked. And you want to then extend that intervention to everyone. That's now how true research works. You have to have a group of people who have the disease and who do not have the disease. And then you come up with an intervention, and the other arm does not get the intervention, and all the other factors have to remain the same. You cannot have old people getting neem juice and then young people not getting neem juice, and then at the end of the study you say, oh, my treatment was successful. Because you had confounding, right? This is what's called confounding, where the age was not matched. So that's why we have to wait for randomized trials to come up with those answers. That's the idea of epidemiology and statistics. So I think that's the misconception which people get, that, oh, I can take this and I'll get cured. Does that answer your question?
Yes, yes, thank you. And one more question, like in news they are showing in India, that more males are affected than females.
Correct.
And one more thing, the person with autism, they are more susceptible, they are more, they can get infected easily. Is
So I'm
there
not
any
sure
study like that?
about I'm not sure about autism. They, folks who are autistic may or may not have underlying other health issues. That's one. But certainly we know that it is affecting older males more than the age of 65. And that's why when folks talk about the ACE inhibitors, it's very interesting data, because the ACE2 receptor is expressed heavily in females and in younger people. But the pattern is that the infection is happening in older men. So they have less ACE2 receptor expression. So this theory that if we give them ACE inhibitors and ARBs and that will increase the ACE2 expression does not hold. Again, we are not, sure about that, but our societies have come up with statements that if you are on that medication, continue that medication. Do not discontinue. So that's where true science comes into play.
Thank you.
All right. Yes, sir. Saurabh has a question.
So you shared history of many viruses, starting from pandemic of 1999 to 47 to 65, 2005, 2013, SARS, H1N1. So I noticed one thing is common in all these viruses. They came from animal to human. Does that mean that nature is giving up indications for 100 years? This that non-vegetarian food is not for the human body.
I can answer that if you want.
That is one question. My second question is, in one of the slides you said that this virus running on the droplets from the ill person can stay on the surfaces. So my question is there any study how long it can stay on the surfaces? And if yes, is there any difference on the various surfaces like metal, wood or any other surfaces?
Yes. So
in terms of timelines.
Yeah, those are two great questions. So let me answer the last one here. It can stay for a few hours in the air, for 4 hours, just in the air. And then on plastics and steel, it can last from 3 to 4 days. So if you have stainless steel at home and someone sneezed on it, it can be alive on it for 4 days. On cardboard, so someone goes to your home and leaves a box outside your home, the virus can stay alive for 24 hours. So there is a study which was done, and they have come up with all these numbers. Actually, if you go to my YouTube channel and watch my first coronavirus video, I have actually given references as well regarding how long can it survive on the surface, different surfaces. The second answer to your first question, there are advantages definitely to a whole plant-based diet. We do not question that. There is more and more data coming out about that. But even when so these are called zoonotic diseases. These are diseases which have transferred or been transmitted from animals to humans. And this has been going on for centuries. Now that we are more aware, we are documenting, medical science is advanced, we are documenting that these diseases are happening. They were happening even before. So you have parrots at home. Maybe you have a parrot or a parakeet or something at home, let's say. I did when I was a kid. And I didn't understand that 2 of my parrots died. And I had no idea why, but today I know why they did. They died of a condition called psittacosis. That's a disease which happens in humans, but it's called avian chlamydiosis in the the birds. It's a chlamydia psittaci is a bacteria which fills the lungs of the birds with water, and they get inflamed and they become puffed up. They cannot breathe. That's exactly the symptoms which happened to my parrot. Now, I was not a medical student. I was a kid. Someone decided to take this parrot and bury it in the ground. So luckily, we did not get infected.
But I think Dr. Shubh, what Saurabh is asking is also about eating meat. Does that have any effect on that or not?
Well, I mean, so if you are, tending to animals and you're butchering them, let's say, or you're butchering sheep, let's say. So that's what I'm trying to get to, that all these 3 out of 4 new infections, by the way, emerging new infections come from animals. 6 out of 10 infections happen from animals. So let's say you are a goat herder and you have sheep in your home and you milk them, you get their wool, you can get anthrax from that. You have parrots at home, you can get psittacosis. Rats are around, someone bites the rat flea, you can get bubonic plague, tularemia. All those things, you are mowing your yard, let's say, and there's a dead rabbit there. It can get you infected. You can get a disease called tularemia. So these are all zoonotic diseases. Now imagine a situation where you have all these animals and they are cutting them and butchering them. So there's spread of these viruses and bacteria which are in these animals into the air. And they're breathing this air, they're living with them, they go to their homes, they go to their children, and they cause these infections. So absolutely staying away from that kind of environment will cause less infection. Now, there are other implications of being a vegetarian, like, heart disease or cancer and all that. That's a different question altogether. That's something we can explore in holistic workshop. But I'm trying to explain that in the context of the infection.
Yeah, actually, but they're related though, Dr. Shubh. To answer Saurabh's question further, what I learned in your holistic workshop, you recommend plant-based diet, right?
Absolutely.
And supposingly you are eating, your cholesterol is high, you're eating like non-vegetarian food, and it has its environmental implication also. So which all actually relates to your immunity going down. Supposing you have a heart disease, you're on say losartan or something like that. It does affect your immunity in some way, which basically, if you get hit with something like COVID-19, if your immunity is already down because of those things, you're already basically vulnerable to these kind of stuff, right?
Absolutely.
Right. So to answer your question, Saurabh, yes, I mean, not directly, probably indirectly it does affect. So being vegetarian is better.
Absolutely. All right. I think we had a good conversation, and thank you everyone for joining. I know you all have to spend time with your families, so thank you so much for joining us today. I really enjoyed this, and I think we should do more of this in the future.
Yeah, absolutely, we should. Yeah. Thank you very much, Dr. Shubh. Really appreciate it.
Thanks everyone for
Thank
coming.
you guys.
Bye.
Thanks for
Thank you,
joining.
Dr.